Hi, I am Dr. Vijay Misra, Associate Professor, Edina Institute of Pharmaceutical Sciences, Sagar, MP, with an interesting and learning episode of B.Pharma on the important unit of anticonvulsants, first and second, including introduction to anticonvulsants, classification of epilepsy, structure-activity relationship, barbiturates, official drugs, hidden twine, oxazolidiones, succinimides, miscellaneous drugs, phenytoin sodium and troxidone, which is one of the important units of section of B.Pharma 6th semester. This presentation is prepared by Mohammad Hasim Mansoori, Associate Professor, Edina Institute of Pharmaceutical Sciences, Sagar, MP, and me. Let's start our episode while taking a look at what we are going to learn today. That is module first, introduction of anticonvulsants, first and second, which includes classification, structures, chemistry. Module second, classification of epilepsy. Module third, structure activity relationship. Module 4, barbiturates, official drugs, hidden twines and oxazolidiones. Module 5th, succinimides, miscellaneous drugs, phenytoin sodium and troxidone. Let's start with general introduction about anticonvulsants. Module first, introduction of anticonvulsants. The origin of seizures was established as early as in 19th century by Jackson. According to him, an intense discharge of gray matter in various regions of the brain initiates the seizures. As a result, it is only a normal reaction of the brain to initiate convulsive seizures. Epilepsy is a brain disorder in which clusters of nerve cells or neurons in the brain sometimes signal abnormally. In epilepsy, the normal pattern of neuronal activity becomes disturbed, causing extraordinary sensations, emotions and behavior, or sometimes convulsions, muscle spasm and loss of consciousness. Epilepsy is a chronic disease that is characterized by paroxysmal attack caused by pathogenic excitation of cerebral neurons. Moreover, there are specific changes in the electroencephalogram EEG for practically all varieties of epilepsy. Seizures are generated in the epileptogenic center of the brain and can be nothing more than shaking of the extremities. If the convulsive discharge begins to spread and the excitation encompasses both hemispheres of the brain, seizures begin. Discharges induce major epileptic convulsive seizures, grand mal, and minor epileptic attacks, petit mal. Generally, seizures are involuntary muscle contractions that take place as a result of pathologic processes both inside and outside the brain. They occur in response to toxins, trauma, hyperthermia, medicinal overdose, or upon discontinuation of medication. Now, we take a short review of classification, structures and chemistry, then we will focus on the anti-seizures. Classification. The various anticonvulsant drugs containing essentially the ureide structure belong to the chemical categories of barbiturates, hidden twines, oxazolidiones and succinimide, and lastly the miscellaneous types of compounds possessing such characteristics. Barbiturates: phenobarbital, methabarbital, primidone. Hidden twines: phenytoin, ethantoin, mefentoin. Succinimides: metsuccinimide, ethosuccinimide, phensuccinimide. Oxazolidiones: trimethadione, paramethadione, dibenzodiazepines, carbamazepine, oxacarbazepine. Barbiturates as a class of drugs mostly possesses sedative and hypnotic properties. Surprisingly, only a few of them rarely show anticonvulsant characteristics. Among the most common barbiturates generally employed as anticonvulsants in clinical use are mifebarbital and phenobarbital structures. Figure 2. Then chemistry. Barbituric acid is 2,4,6-trioxohexahydropyrimidine. This compound lacks central depressant activity, but the presence of alkyl or aryl groups at position 5 confers anticonvulsant and sometimes other activities. The general structural for the barbiturates is given below. Figure 3. General structural for the barbiturates. The carbonyl group at position 2 takes on acidic character because of lactam-lactam ketoenol tautomerization, which is favored by its location between the two electronegative amido nitrogens. The lactam form is favored in alkaline solution and salts result. Barbiturates in which the oxygen at C2 is replaced by sulfur sometimes are called thiobarbiturates. These compounds are more lipid soluble than the corresponding oxybarbiturates. In general, structural changes that increases lipid solubility decrease duration of action, decrease latency to onset of activity, accelerate metabolic degradation. Dear friends, till now you have gained a complete idea about seizures, classification, structures and chemistry. If you have missed any of the module or content, you may log on to our website www.cec.nic.in to download videos, FAQ, LOR and other contents so that you can remain updated with this chapter. Friends, now let's move ahead to our next module, that is about classification of epilepsy. Module 2. Classification of epilepsy. Epilepsy are classified broadly as partial seizures. In this, abnormal excitation initially occurs in a small number of neurons but may spread to adjacent area. Simple, consciousness not impaired. Second, complex partial seizures, psychomotor seizures begin as simple partial seizures processing to complex seizures. Third one is partial seizures evolving to secondary generalized tonic-clonic seizures. Second category is generalized seizures, convulsive or non-convulsive. In this, entire brain is affected. It is divided in first, absence seizures. It includes typical seizures, patental, atypical seizures. Second category is myoclonic seizures. Third one is clonic seizures, then tonic seizures, again tonic-clonic seizures known as grand mal. Next one is atonic seizures. Third category is unclassified epileptic seizures including some neonatal seizures. It includes partial seizures. It is divided into three categories: simple partial, complex partial and partial processing to generalized seizures. The difference between simple and complex partial seizures is the level of consciousness of the person undergoing the seizure. In partial seizures, initial neuronal discharge originates from a specific limited cortical area which is termed as focus. Development of focus is thought to be caused by scarring after head trauma, infection or oxygen deprivation. These types of seizures are possible at all ages but mostly in elderly patients. Second one is simple partial seizure. It will depend on the area of the brain that is affected and they will occur on the opposite side of the body from the lesion. The temporal lobes are most common organization site for partial seizures. The patient consciousness is not impaired and person able to respond simple commands, movements and recall events during seizures. Next one is complex partial seizures. In complex partial seizure, consciousness is impaired and will be manifested by person staring, inability to respond to simple commands, inaccurate recall during seizures. Next is partial processing to generalized seizures. The abnormal electrical activity responsible for any type of partial seizure can be generalized throughout the brain and therefore developing into secondary generalized tonic-clonic seizure. The generalization may occur rapidly or may occur slowly. Next is generalized seizures. These disorders are generalized from outset and they show simultaneous involvement of both cerebral hemispheres and loss of consciousness. The initial neuronal discharge spreads quickly into entire gray matter. The cause rarely is known, but it usually is attributed to diffuse lesions, to toxic and metabolic disturbances, or to constitutional genetic factors. People of all ages are affected by generalized seizure. Next one is absence seizures. Absence seizures begin with a change in facial expression which is followed by a period of motionless, blank staring. These are divided into typical and atypical absence seizures. Typical absence seizures have a rapid onset and cessation. Person cannot be altered during seizures, typical common in children than adults. However, atypical absence seizures have a slower onset and cessation and then last longer. They may include clonic motions, automatism or autonomic symptoms. Next one is myoclonic seizures. It consists of sudden, very brief, jerking contractions that may involve the entire body or be confined to limited area such as face and neck. The contraction may affect individual muscles or group with simultaneous contraction of both extensor or flexor muscles. These seizures occur in all age groups with symptoms ranging from rapid tremors to falling down. Tonic seizures. Tonic seizures are characterized by increasing tone in extensor muscles, resulting in falling to the ground or mostly occur in children. The duration of contractions is somewhat longer than in myoclonic seizures. Vocalization may occur as a result of contraction of thoracic muscles forcing air past the larynx. Next one is atonic seizures. In this seizure, a very sudden decrease in muscle tone occurs, leading to a head drop, drooping of limb, or loss of muscle tone, resulting falling down. The risk of injury is high in these sudden drop attacks. It is more common in children. Next one is clonic seizures. A loss or impairment of consciousness occurs simultaneously with decrease in muscle tone or with a generalized tonic contraction and followed by period of asymptomatic jerking motion. It nearly always occurs in babies or young children. Next seizure is tonic-clonic seizures. This represents a maximal epileptic response of the brain. These are characterized by the absence of an ear or by tonic stiffening of all muscle group causing patient to fall. The initial contraction may be flexor or rapidly followed by prolonged extension. The seizure may be associated with the loss of bladder control and biting of the tongue or inside of the mouth. Module 3rd, Structure Activity Relationship, that is SAR. Several major groups of anticonvulsant drugs have the common structure shown below. Figure 4 SAR of general anticonvulsant drugs. As a general example given in the figure 4 shows that both R and R dash should be hydrocarbon radicals. If both R and R dash are lower alkyls, the tendency is to be active against absence seizures and not active against generalized tonic-clonic or partial seizures. If one of the hydrocortico substituent in an aryl group, activity tends to be directed towards generalized tonic-clonic and partial seizures and not anti-absence activity. A conformational analysis of the aryl containing anti-generalized tonic-clonic agent indicates that the conformational arrangement of the hydrophobic group is important. Figure 5, SAR of barbiturate ring. Important points to be taken into consideration with respect to the structure-activity relationship amongst the barbiturates are as follows. First one is total number of carbon atoms present in two groups at carbon 5 must not be less than 4 and more than 10 for the optimal therapeutic activity. Second one is the branched chain isomer exhibits greater activity and shorter duration. So, greater the branching, the more potent is the drug. Third one is double bonds in the alkyl substituent groups produce weak compounds, that is they are short acting. Fourth one is aromatic and alicyclic moieties exert greater potency than the corresponding aliphatic moiety having the same number of the carbon atoms. Fifth one is short chains at carbon 5 resist oxidation and hence are long acting. Sixth one is inclusion of a hydrogen atom in the 5 alkyl moiety enhances activity. Seventh one is inclusion of polar groups like OH, CO, COOH, NH2 etc. in the 5 alkyl moiety reduces potency. Eighth one is methylation of one of the imide hydrogens enhances onset and reduces duration of action. Ninth one is replacement of sulfur for the carbonyl oxygen at carbon 2 results in thiobarbiturates which exhibits a rapid onset and short duration of action. Next one is addition of more sulfur atoms decreases activity. Friends, now we move on the next module, module 4, barbiturates, official drugs, Harden-Twine derivatives and oxazolidiones. First one is barbiturates, official drugs. It includes phenobarbital. It is commonly used for convulsive disorders and is the drug of choice for seizures in infants up to 2 months of age. It gets metabolized in vivo in two different stages. First by hydroxylation to 5,5-hydroxyphenyl 5-ethyl barbituric acid, and secondly it gets conjugated with either glucuronic acid or sulfuric acid. The metabolic product is ultimately excreted through the urine as its corresponding glucuronide or sulfate salts. By good quality of its natural liver enzyme inducing characteristic phenobarbital helps in enhancing the metabolism of such drugs that are usually metabolized by the microsomal enzymes. Phenobarbital noticeably reduces the excitation of motor centers of the brain and therefore is used in treating both minor and major epileptic attacks, chorea and spastic paralysis, luminal, adrenal, seconal and many others are synonyms for this drug. It is a weak acid that is approximately 50% ionized at physiologic pH and well distributed into the CNS. Serious toxicity is rare. However, drowsiness is the most common side effect. Next is mephobarbital. It loses N-methyl group through metabolism in liver and gets readily converted to phenobarbital, which may be excreted in the urine. It is less commonly used in the treatment of generalized and partial seizures and may be less sedating in children. Next one is methabarbital. It is mostly demethylated to barbital in vivo. Also, it possesses more sedating property than phenobarbital. It could be safely recommended for grand mal seizures. Next one is primidone. Figure 6. Structure of primidone. Primidone 5-ethyl 5-phenyl hexahydropyrimidine dione 4,6 is synthesized by reacting ethyl phenyl malonic acid with diamide with formamide. An alternative method is the electrolytic reduction of phenobarbital or the catalytic reduction of the appropriate 2-thiobarbituric acid. It is used in the treatment of simple, partial, complex partial and tonic-clonic seizures. Next one is hydantoin derivatives. The hydantoins are close structure relative of the barbiturates, differing in lacking the 6-oxo group. They are cyclic monoacylurea rather than cyclic diacylureas. As a consequence of losing a carbonyl group, they are weaker organic acids than the barbiturates. The aqueous solutions of sodium salts, such as of phenytoin sodium, generate strongly alkaline solutions. Hydantoins prevent high frequency activation of the epileptogenic center and also facilitate secretion of sodium ions, which reduces excitation of neurons and prevents their activation upon contact with impulses from the epileptogenic centers. Next one is phenytoin. Figure 7. Structure of phenytoin. Phenytoin 5,5-diphenyl hydantoin is the first anticonvulsant in which anticonvulsant activity separated from sedative hypnotic activity. It is often cited as the prime example of an anticonvulsant acting as a sodium channel blocker. One effect of neuronal sodium channel blocker is to decrease presynaptic glutamic acid release, giving anticonvulsant activity. The drug is useful against all seizures types except absence. Next drug is mefentoin. It is 5-ethyl 3-methyl phenyl hydantoin, is metabolically and dealkylated to 5-ethyl 5-phenyl hydantoin. It was introduced as a sedative, hypnotic and anticonvulsant under the name of nerbinol. It was withdrawn because of the toxicity. Next one is ethantoin. Figure 8. Structure of ethantoin. It is 3-ethyl 5-phenyl hydantoin and dealkylated and p-hydroxylated are metabolites of ethantoin. And dealkylated metabolite is active compound in which hydroxyl group is then conjugated. The compound is used against generalized seizures. Next category is oxazolidiones. Replacement of the NH group at position 1 of the hydantoin system with an oxygen atom yields the oxazolidine 2,4 dione system. The oxazolidine system is sometimes compared with anti-absence activity. Aryl substituted oxazolidine 2,4 dienes have shown activity against generalized tonic-clonic seizures. The oxazolidiones group of anticonvulsants used clinically has shrunk to one clinically useful member. Toxicities associated with the group may be the problem. First one is trimethadione troxidone. Figure 9. Structure of trimethadione troxidone. It is 3,5,5 trimethyl 2,4-oxazolidine. It was first drug introduced specifically for treating absence seizures. It is important as a prototype structure for anti-absence compounds. Dermatological and hematological toxicities limit its clinical use. The drug is metabolized by N-demethylation to active metabolite dimethadione. It is a calcium channel blocker. Dimethadione is a water-soluble and lipophilic compound. Next one is paramethadione. Figure 10. Structure of paramethadione. Paramethadione 5-ethyl 3,5-dimethyl oxazolidine 2,4-dione differs from trimethadione only in the substitution of one methyl group with an ethyl group. Paramethadione is also used in minor forms of epilepsy. Friends, now we move to the next module, that is module 5, succinimides, miscellaneous drugs, phenytoin sodium and troxidone. Succinimides. Due to the inherent high level of toxicity recognized by the oxazolidiones in prolonged therapy as anticonvulsants, a dynamic effort was made to replace them with better effective and less toxic drugs. Succinimides are a group of drugs that are derived from the amide of succinic acid. They are used in minor forms of epilepsy in which attacks are not observed. Oxazolidine 2,4-diones substituted succinimides CH2 replaced with O were a logical choice of the synthesis and evaluation. Three members of this class of compounds were introduced, namely phenoxamide, methoxamide and ethosuximide. First one is phenoxamide. Phenoxamide N-methyl 2-phenyl succinimide is used primarily against absence seizures, but it has low potency. The phenyl substituent confers some activity against generalized tonic-clonic and partial seizures, and demethylation occurs to yield active metabolite. Both phenoxamide and dimethyl metabolite are inactivated by para-hydroxylation and conjugation. Phenoxamide is an anticonvulsant drug that is used in minor forms of epilepsy. Next drug is ethoxamide. Ethoxamide is 2-ethyl 2-methyl succinimide and used for anti-absence activity. The drug is more active and less toxic than trimethadione. It is a calcium channel blocking drug. Toxicity primarily involved the skin and blood. The major metabolite is produced by oxidation of the ethyl group. The next drug is methoxamide. Methoxamide is N,2-dimethyl 2-phenyl succinimide and used against absence as well as complex partial seizures. Next category is miscellaneous drugs. A number of compounds bearing different miscellaneous basic chemical structures have been found to possess significant anticonvulsant properties. A few such compounds are dealt with in this section, namely primidone, phenacimide, carbamazepine, valproic acid, clonazepam. First one is carbamazepine. 5H-dibenz BF largepine 5-carboxamide for SAR discussion possesses can be viewed either as a ethylene bridged 1,1-diphenylurea or an amido substituted tricyclic system. The two phenyls substituted on the urea nitrogen fit the pattern of anti-generalized tonic activity. The overall shape of the molecule suggests the mode of action: block the sodium channel. Carbamazepine is useful in generalized tonic-clonic and partial seizures. The drug has the potential for serious hematological toxicity and it is used with caution. Next drug is primidone, 5-ethyl dihydro 5-phenyl 1,6,1-H 5-H pyrimidine dione is sometimes described as a 2-deoxybarbiturate. It appears to act as such and through conversion to phenobarbital and the phenyl ethyl malonyl diamide. The efficacy is against all types of seizures except absence. The agent has good safety but rare serious toxic effects do occur. Next drug is valproic acid, 2-propyl pentanoic acid has good potency and used against several seizure types. They include typical and atypical absence seizures and absence seizure generalized tonic-clonic seizure. This is a sodium channel blocker. Many of the side effects are mild and rare but potentially fatal. Its mechanism of action may be related to increased brain levels of the inhibitory neurotransmitter gamma aminobutyric acid, that is GABA, GABA. This increase in brain content of GABA is probably due to the inhibition by valproate sodium of the enzymes that metabolize GABA. Next drug is clonazepam. Clonazepam 5,2-chlorophenyl 3-dihydro 7-nitro 2H14 benzodiazepine 2-one is partially selective at benzodiazepine allosteric binding site of GABA receptors. It is useful in absence seizures and in myoclonic seizures. Tolerance to the anticonvulsant effect often develops, a common problem with the benzodiazepines. Metabolism involves hydroxylation of the 3 position followed by glucuronidation and nitro group reduction followed by acetylation. Next drug is phenacimide. Phenacimide, generally known as phenylacetylurea or benzene acetamide or N-aminocarbonyl, is readily prepared by reacting phenylacetyl chloride and urea with the elimination of a molecule of hydrogen chloride. It is mainly used in the psychomotor type of seizure. It is relatively lesser therapeutic value in absence seizure, generalized tonic-clonic seizure and in mixed seizures. Now we move on summary. Epilepsy is a symptom complex characterized by recurrent paroxysmal aberrations of brain functions. All forms of epilepsy originate in the brain and appear to be the result of changes in neuronal activity. These changes, such as an excessive neuronal discharge, may be disturbance of physicochemical function and electrical activity of the brain. All normal neurons may become epileptic if subjected to excessive excitation. The origin of seizures was established as early as in 19th century by Jackson. According to him, an intense discharge of gray matter in various regions of the brain initiates the seizures. As a result, it is only a normal reaction of the brain to initiate convulsive seizures. Epilepsy is a brain disorder in which clusters of nerve cells or neurons in the brain sometimes signal abnormally. They are classified broadly as partial seizures, in which abnormal firing initially occurs in a small number of neurons but may spread to adjacent area, and generalized seizures, in which entire brain is affected. The various anticonvulsant drugs are available for treating different type of seizures. They containing essentially the ureide structure belong to the chemical category of barbiturates, hydantoins, oxazolidiones and succinimides, and lastly the miscellaneous types of compounds possessing such characteristics. Till then, keep studying. Goodbye.